Hey team, so this is a super sweet patient of mine, and I'm marking out here her upper eyelid blepharoplasty. The most important part of the upper eyelid blepharoplasty marking is what I'm doing right here, which is the lid crease. And so you mark it out, and I like to preserve the natural lid crease for a patient more so than going off of statistical numbers. So you can see what I'm doing is having her look up and down, and by doing so, I can see where her eyelid natural fold is. And that's where I make the markings, because that's where her markings have been, where her lid crease has been for her entire life, and I want to keep that. So I mark it out, and I think it's really important to mark out a patient standing up because that's how we live, not lying down on a table. And then, so you see I'm pushing up and down her lid to kind of see exactly where the fold naturally used to sit. And then I have her look up, look down, and then by the punctum, which is where the tears drain into, that's the innermost corner of the incision marking. And then here I'm marking the outside corner of it, and you can see I'm allowing it to fold nicely, so that way the incision's hidden because it's just in the natural lid crease. So now that the lid crease is marked out, that's probably the most important thing. The second most important thing is how much to take out. The next thing I do though is that little flap of skin that people have out there. So you can see I kind of like map out how that little piece of skin, that flap, wants to be cut out. And you can see whatever's in between those two pinches of skin, that's what's going to be gone. And she'll be left with like a nice, natural, normal looking fold. Here you can see like there's a little bit more of that skin. And so I mark out what needs to go out, and then bam, so that's going to go. And she'll be able to put nice little bit of makeup on without it smearing there. Then here on the inside corner, I want to mark out so that we take out the extra fold. You make it look like a trapezoid because that makes the skin fold nicely like that. And then now what I'm doing is I'm making the extent of how much skin I plan on taking off. So this first pass here is, I actually don't even like use it too much. It's more of like a rough estimate to get the contour, right? So like I'll have her look up, look down, and then look straight again. And then this is just giving me a rough estimate of like where the contour of the ultimate lid crease of the ultimate incision is gonna be. And I'm pretty conservative with these things. Like for me, I'd say the most important thing, less is better. You should look like a natural version of yourself, like not taking off too much. So the first markings are actually always a little bit higher for me because I'm very conservative with these things. I think it's important to really like give you a natural look, take off a little bit of skin, but not go do anything too crazy or anything wild. It's safer, it looks better. Everything about being conservative with these things is better. And then on the inside corner is where people have a little bit of fat that pooches forward. So you'll see in a second, I'll mark that out. So I'm just making it symmetric between the two eyes. And you can see by moving her brow up and down, I'm following the natural crease of like where her skin has stretched out over time. So I'm following that little like, it's very barely visible. It's hard to see sometimes on a video, but like there's a little stretch mark where it kind of like used to be and then where it stretched out over time. So that's why I'm bringing you back from like where it was to where it should be. And then now what I'm marking out is the fat. So there's a little pooch on the inside corner. So I push the eyeball forward a little bit, you don't feel it. And then that shows me where the fat is, and it helps me mark out because when you lie flat back, it kind of sinks back a little bit. So you can see I'm just marking out that little. What I'm doing is I kind of like ascertain, there's a little bit more fat on her right side, so I put a 2 over there and a 1 on the left side, just so I know during the surgery she had a little bit more fat on one side than the other side to try to keep it as symmetric as possible. Now, she also had a lower lid blepharoplasty. So here you see I'm marking out her lid crease, and then now marking out like the medial and the central fat pads, like the middle and the inner corner of the fat pad, and that's the lateral, which is the outside corner fat pad. All right, so I was actually an electrical engineer before med school, so I approached marking from both like an aesthetic perspective, but also from a very technical perspective. And I think it's actually the most important part of the entire procedure. For me, the rest of the procedure becomes very easy after marking. So I take my time with it. I think it's really important to mark patients upright, take my time with it, not be rushed, make sure that the patient's comfortable. And then that makes everything else after the procedure so much easier. If you have any questions about marking, feel free to call anytime. Thanks so much.